Hi everyone, this is Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness, and I'm treating my office manager today. She's complaining of some pain. Alexia, where are you having the pain?
I'm having left sciatica pain. It's very common when I kind of have long road drives, so I had a long drive this couple weeks, so now it's hurting.
Yeah, so she's pretty miserable. She's kind of dragging her leg behind her around my office. So for the interest of helping her feel better for sure, then we're gonna do some assessment, okay? Here we go.
I don't know.
Right. So the first thing we're gonna do for Alexia is we're gonna assess her pelvis, how it's kind of rotated, if it's flaring in, flaring out, or flaring in, flaring out, and assessing leg lengths as well, which is super important because if we don't have equal leg length, then it'll automatically tilt our pelvis in one direction or the other, which then can contribute to the pain. Go ahead and bend your knees up for me. Perfect. And you're going to squeeze your tushy and lift your hips all the way up to the ceiling and then just drop them. Okay, so now you set them. I want you to drop them. Ready? Go up. And then blah. Perfect. Very good. So we're going to pull down here. And we can already see there's actually a substantial leg length discrepancy here. She's got about 1/4 of an inch difference between her right and her left leg. Left leg is acting shorter. Doesn't mean that it's actually shorter. It could just be that one hip bone is actually rotated to make it shorter right now. So that's probably why this side is hurting her pretty substantially. When we get down to our patella, pulling them down with just a little traction. And here I'm seeing that this left is lower, but here it's higher. So that's telling me that between here and here is a little shorter between the right side of that tibial height. Okay, when we come up here, we're gonna look at the ASIS. Both sides, and again I'm seeing that this left hip is really rotated posteriorly, so, and it's inflared a bit. So what that means is that this left leg is actually anatomically shorter than her right, and this hip has rotated to try to make that left femur go down lower to make those legs at the same length. So it's really trying to compensate as best it can, and it's doing kind of a piss poor job of it, to be quite honest, which is why she's now having pain. So as that hip starts to rotate, it puts kind of a strain at the sacrospinous ligaments, at those gemelli muscles where that sciatic nerve comes out, and that can cause some impingement over time. So this is not an uncommon complaint. Okay. All right, so we're back. We're just kind of continuing the assessment. So she's laying now prone. Just kind of a relaxed pose, and we're going to lift up here, and again we can assess. You can even see here as we straighten out her feet, this right side is longer than the left side, so it's again probably about 1/4 of an inch difference, which is going to make a difference in the long run in how her whole carriage goes. So now we have some rotation here in the hips as a result of this leg length discrepancy, which will then create a curvature in the lumbar spine, then the thoracics, the neck, which affects our shoulders, and it affects the carriage of our head. The whole point of our body is to make sure that we're always keeping our eyes on the even horizon. So it will do whatever it needs to do to compensate for that, to make sure that we're interpreting the world on that even horizon. So that's what it's done, and it'll make these compensatory kind of alterations to our form in order to accommodate that. So as I'm feeling here, I kind of feel between the L5 and S1, here's the sacrum, very nice. And there's a nice spring here, so that's great. She's like 15 years old. She's 22. So she actually has nice spring to her joints and in those joint spaces, which is really good. I feel the sacrum is just a little rotated here to the right. Again, it's probably having to do with this compensation here on the left, trying to get the hip to push down to make this left leg a little bit longer. Okay, is that where you're having the pain? So I found the pain, and she got a tensed up here and right here in the middle. So this is the gemelli muscles. You're going to find them running between the inferior aspect of the sacrum and the greater trochanter of the femur. And when you kind of target right in the center there, you can absolutely feel that that's where the sacrum comes out from the pelvis out to the posterior aspect of the hamstring, and that's where you can find that trigger point. So there's a couple of things that we can do to help treat this. One, go ahead and scoot towards me just a little bit, just to the side. Yeah, there we go. Okay, so one of the things that we can do is just kind of shorten those gemelli muscles. So when you shorten the belly of the muscle and kind of put it into a contracted state, then it can't continue to spasm. So then it'll help to release that muscle, release the fascia around the muscle, which in turn releases that tension that's being placed around that nerve, which really makes that nerve pretty upset. Okay, so what we do, I always call it the dog peeing position, so there's like no better way to describe it. But we kind of pop the hip off of the side here with the knee. And you want your patient to relax as best she can. And then we're gonna kind of move this up. Go ahead and relax. To the side. And we get it in a position such that the pain is minimized. How's the pain right now?
It's better.
It's better? Mm-hmm. And we just kind of hang out here, shoot the breeze, talk about the kids, you know, because we've got to give this muscle time to reset itself. So right now it's going to be trying to freak out and spasm on its own, only for it to realize that it can't spasm anymore because it has nowhere else to go. It's already shortened. So then that'll help to reset those neurotransmitters that are going to the brain that keep saying, hey, there's pain here, I need to contract and protect myself. Once it kind of settles down and breathes, then we put the leg back into its neutral position and we recheck the tender point. Okay, we're back, and it's probably been about maybe a minute and a half. And what I was explaining is to the ladies when we had stopped the video, what you'll initially feel is that you'll feel the tissue heat up under where I have this trigger point or the strain counter strain point. It'll get really, really hot, and then you'll start to feel everything just kind of oscillate, almost like a brownie in motion kind of sensation. And all of a sudden, it's almost like the tissue just goes, and you feel the whole thing release. And so now we've felt that release, even Alexia can feel it. So now I'm just gonna very passively put her leg back into the neutral position, so don't do anything. Okay, and we're gonna slide this guy back up onto the bed. I won't let you fall. Okay, and then here's that spot that I was poking earlier, and she was really coming off the table. It was so tender. How is it now?
I don't feel it.
You don't feel it. So I have not moved my hand through this whole procedure. It's the magic. So with that, then now she's feeling much better here. Fundamentally though, we haven't really fixed the issue, right? I haven't addressed her leg lengths, and if I kind of pop her knees back up, we're gonna see we still have this leg length discrepancy. So that's still a very real issue, and we're gonna address that right now. Go ahead and roll over onto your back. And you're gonna be closer to this side. Yep, very good. Okay, so what we're gonna do now is we're gonna fix this posterior rotation of the left hip. So it's kind of rotated backwards like this. I wanna bring it back forward. So we're gonna use the strength of her psoas muscles to actually pull that os coxa forward, okay? So again, I'm not gonna let you fall. I have nice support here for her. I have to be aware of my own body dynamics as well. If I'm gonna be doing this for 20, 30 years, I wanna make sure that I'm keeping my back and my hips intact as well. Probably the heels don't help. Okay, but we're gonna go ahead and slide this guy right off the table, just relax. Okay, and sometimes, depending on the size of the individual, it's nicer to kind of support on the opposite hip so they feel like they're not rolling off towards you. Okay, now we're gonna do a muscle energy technique. Right here on my hand that's just above your knee, you're gonna press up towards the ceiling with about 40% of your strength. Okay. We're gonna do that for 3 to 5 seconds, 3 to 5 times, okay? Go ahead and push up for me, a little harder, a little harder. Good, that's good. And relax. And we're gonna reposition. Good, and so when I'm repositioning, it's pulling that whole hip forward now. Okay, go ahead again. Good. And relax. Again, reposition, pulling that hip forward. And one more time. Perfect. Okay, and relax. One last stretch. And then again, I'm gonna very passively kind of pull her leg back up. Go ahead and scooch towards the middle of the table. And we're gonna do that hip drop one more time. Okay, great. And go ahead and lift your hips up and drop them down. Big flop, good. Now, interestingly, we are probably not going to fix her leg length. We're gonna make it worse. What? So what we've actually, you can really significantly see it now, it's probably off now by almost a ½ inch, okay? It's a good centimeter. And the reason why is I wasn't fixing her leg length, I'm fixing the pelvis rotation so that we're not gonna continue to have that strain on the sacrospinous ligaments and around those gemelli muscles and where the sciatic comes out of the greater sciatic foramen. So as a result, then I've actually made that leg length worse because I removed the compensation at her pelvis. So now how do we fix this? And the answer is we have to do it mechanically. So I'm gonna ask Alexia now in the future to wear a shim in this left foot. So just using like Dr. Scholl's or whatever little orthotic within the shoe, but only on one side. And then that's gonna give her that little 1/2 inch of a lift to keep that pelvis from rotating again to try to make it better. So let's take a look here. Her patella are now better placed. And then if we take a look at the ASIS, spot on. We are spot on. We've reduced that rotation here, but now we have to fundamentally fix this. So that's how you deal with sciatica, or at least one way to deal with sciatica. I hope you enjoyed it. If you have any issues with this, give us a call. Our number is 714-900-3091, and our website is www.transformationhealthtoday.com. Go ahead and sit up. Let's see how you're doing. At least you can sit.
I feel better.
Yeah, about 60%.
Yeah, I don't feel like the pain
That pulling.
shooting or pulling up.
Nice.
So I feel good.
All
Thank
right,
you.
fantastic.